We're a mild to moderate withdrawals, the clients that we work with. So we're talking about, say, alcohol. So if a person is on the severe side of an alcohol withdrawal, they would need a higher support than what we can give them. So ours would be mild to moderate.
Clients who are dependent users, so usually daily users, and who would require a medically supported detox. We would initially do a telephone assessment, then a face-to-face assessment, and then, if all goes well, plan to see them in their home and commence a detox.
We work very closely with the client. We monitor their symptoms. We make sure that us doing the withdrawal with them is not actually exacerbating any of their other problems. So it's just being close and being able to talk to the client and their family and just building that relationship.
The nurses co-locate at drug service teams in the community. So there's 6 nurses and they operate over the whole metro area. And the beauty of that is that they attend case studies, they attend intake meetings, and they have that collaboration with the ongoing counselling team and the medical team also at the CADS, which is the Community Alcohol and Drug Services.
Quite a lot of people are unable to take a lot of time off work to go to rehab after a withdrawal, whereas we can work with people for a couple of weeks, or depending on what substance it is, until we get them engaged in some sort of counselling, and whether that be drug and alcohol counselling at one of the CADs, or if there's quite a lot of trauma and underlying issues, we can liaise with the GPs about doing mental health care plans, and then those people can go on and get psychology support.
Going to somebody's home makes it easier for the person and the family. Sometimes they have pets, they don't want to leave, they've got young children, and so it's a really good alternative, and it encourages more women to seek treatment.
Also, people with disabilities, they find it really difficult to leave their home, or if they're carers they care for someone with a disability, leaving the home is quite traumatic. But if they have someone that can support them to stay in the home to do this, it's a lot more successful.
So it's very important that they have a support person. And this might be 24 hours a day for the first 5 days, or it could be, if they're doing a slow reduction from a certain substance, it might mean a little bit less support. However, they do require a support person. First engagement, or that first contact with the service, is vital. So yeah, that's very important, because we have people who, like Anne said earlier, are traumatised in their life. There's all sorts of reasons why they might be using substances, but we want them to come in and we want to help them. So we don't want to set up any judgments or anything to prevent them or drive them away.
It's pretty much educating them before we even start about, what could happen, what may not happen, educating them that everyone's different. Some people get more symptoms than other people. Taking this time out of their lives to sort themselves out is really hard for them. And then if they come to a service where the look on someone's face already tells them that they're not going to have a good reception, whereas we believe that every opportunity for a positive encounter with someone, it opens up the door for them to go, well, gee, I didn't do it okay this time, but next time I'm going to give it a go. And they're not so afraid to call us back and go, look, we did a month, and but I've lapsed back. Can we come back? And there's no issues around. We don't penalise people because they haven't been able to get it right. But we do quite a lot of mindfulness with our clients. We talk about relapse prevention strategies. It's basically really the engagement and the support and just grounding them when things are getting out of hand. You know, a perfect withdrawal is a withdrawal where you don't get a bill, or the kids don't kick up, or you know, you have a disagreement with your partner or something like that. So it's life and things happen during withdrawals, so it's all about keeping a calm presence and working through the day-to-day issues with the client. Look, most clients have got it in their head what they want to do. We're just their means to getting to where they want to go.
It's very important to be able to offer different options to people when they're going to discharge from the service. So not, you know, there's no one fits all model of aftercare or counselling. There's lots of different options, like smart recovery groups, NA, AA, one-on-one counselling. Some people prefer the one-on-one and some people prefer group. So it's trying to find something that's going to suit the client, because at the end of the day, if they're not going to take it up, it's not going to be any benefit to them.
There's a lot of shame that goes with addiction. A lot of people are totally ashamed about how they've got themselves into this predicament. They don't know how to express themselves in group settings because the shame is so great, and sometimes it's good for people to go and talk about a lot of that shame, get a bit of that self-esteem going for them, more improved outlook about their own self-esteem before they can venture into the groups. But some people just thrive in the group setting, so it totally depends on the person. And you know, there's a lot of fear that comes with this, so we just take it per client, how they want to go.
Pick the phone up and we have a triage system where we usually can ring them within 48 hours, and sooner if we can. But usually it's around 48 hours when we can ring them back, and we try and get back to them as soon as possible. Like I say, while there's that window of opportunity and they don't change their mind, which is quite a common thing for somebody who's trying to make a behaviour change or trying to seek help.